Okay, it is 11:01, so we will get going. So good morning, everyone, and thanks so much for joining us for a virtual STEGH Talks session today. Just a few quick things to note before we begin. In an aim to reduce background noise, we're going to be muting everyone except Kelsey. If you have any questions during the presentation, please type them in the chat field, and we'll try to answer as many as we can during the Q&A. And this session will be recorded and shared at a later date on our Facebook page and YouTube channel. On behalf of the STEGH Foundation and the hospital, we welcome and thank you for joining us for today's STEGH Talks virtual session, Nutrition Month edition. It is my pleasure to introduce Kelsey Russell-Murray, a clinical dietitian at STEGH. Kelsey is also the founder of Gut Healthy Dietitian and has been working as a full-time registered dietitian since 2013. Thanks so much for joining us today, Kelsey. Take it away.
All right. Hi, everyone. Welcome to STEGH Talks Nutrition Edition. So I'm Kelsey, like Kenzie said. I'll just give you a quick bio. I've been at STEGH for over 8 years now, most of my career. I'm a registered dietitian. I have an Honours Bachelor of Science from St. FX and a postgrad in dietetics, and I also have a Master's of Science from McMaster. Like Kenzie said, in addition to my work at STEGH, I have a private practice where I do one-on-one nutrition counseling and recipe development, nutrition article writing. I specialize in gut health and digestive disorders, plant-based diets, and sports nutrition. And I'm actually on maternity leave right now. I have a 10-month-old son, Blake, and my 3-year-old son, Jace, is turning 3 this weekend. So that's me. So the reason we're doing Nutrition Month edition or nutrition in March is because March is National Nutrition Month. So today during the presentation, I'm going to be talking about kind of the role of the dietitian at STEGH. I'm going to talk a little bit about Nutrition Month and what the theme is this year, and then we'll do a Q&A. So I am happy to answer any nutrition questions. So if anyone has any, you can send them in the chat throughout or ask them at the end. All right, so I'll talk a little bit about dietitians at STEGH, what we do. So there's 3 of us. 2 of us work on the inpatient units, and 1 of us works outpatient in the Diabetes Education Center. So Ashley and I are the inpatient dietitians, and we provide clinical nutrition service to all of our inpatient units. So personally, I cover ICU, stroke, one of the medical floors, and mental health. So it's quite a wide variety of units. That's one thing working in a community hospital, you really become a generalist. And we cover each other. So we have to really be familiar with all areas of nutrition, from peds to adults to, critical care, surgery, the whole thing. So it's a really interesting job, always keeps me on my toes. So I thought today that I would just go over kind of 4 main areas of our role to introduce people to what we do, because it's a little bit different. When I tell people that I work as a dietitian, they always say, oh, so you tell people what to eat. But as a hospital dietitian, that's really only a small percentage of our role. That's why I wanted to start with nutrition education, because that's what people think of when they think of dietitian. But one thing I've learned for working almost a decade as a dietitian is telling people what to eat really doesn't work, makes almost no impact. I may know a little bit more about nutrition or disease-specific nutrition, but most people in general, they have an idea of what they should be eating or what's healthy and what's not healthy. The problem is a lot of people aren't putting that into practice. So I really look at it as my job to kind of break down, identify what are the barriers. So if you know what to eat, why are you struggling so much to put some of those lifestyle interventions into place? What are the challenges? So if someone works really long working hours or who has young kids, so they're too busy, so they rely a lot on convenience foods, I'm looking at, okay, can we come up with really quick and easy meals that we can make during the week? Or are there options to prep healthier food ahead of time? Or could we find healthy alternatives to the convenience food that they're already eating? Or if someone's really dealing with food security issues, we know that oftentimes healthier food is more expensive. So is there a way I can help them navigate that? Can they use less expensive forms of protein like beans or legumes, or use frozen produce instead of fresh? So I really kind of look at it as my job to not just educate, but kind of navigate the patient as a whole. So the types of education, like I said, we see everything, but the ones that I do over and over most days are cardiac education for stroke and heart attack patients, renal education for those with kidney failure. That's actually one of the more complicated diets, and a lot of people with renal disease also have diabetes, and they're kind of conflicting diets. So helping people navigate those two different diets, diabetes, post-surgical transition diets, so especially patients who had GI surgery or who haven't eaten in a prolonged period of time, how we kind of progress back to a regular diet, digestive conditions like IBS or Crohn's and colitis, on the surgical floor, a lot of pancreatitis and gallstones, and we work with the SLP, the speech language pathologist, to provide texture modified diet education a lot as well. So we can see anything, but those are kind of the primary educations that I do over and over. And like I was saying, it's not actually as big a percentage of my role as people would expect. It probably takes about 10 to 20% of my time. So from there, I'm going to go to malnutrition. So malnutrition takes up a huge percentage of my time. So I've given the technical definition there, but really the type of malnutrition that we're seeing in hospital is undernourishment because people are not eating enough. And it's because they're sick and they don't feel well. But the reason I want to take some time to talk about malnutrition is it has such an impact, and some of the stats around it are pretty staggering. So when we look at the prevalence of malnutrition, a couple of years ago, a group, the Canadian Malnutrition Task Force, did this big study across Canada and actually found that 45% of patients on admission to hospital were malnourished. So almost half of all patients coming in to see us are malnourished, which is pretty alarming because I'm going to touch a bit more on some of the negative impacts and consequences of malnutrition. But we know that if they're coming in, almost half of our patients malnourished, those numbers are only getting worse during their admission. So they're losing weight, they're losing muscle mass, they're mostly in bed. Of course, hospital food, we actually have excellent hospital food service, but it is hospital food. It's not the same way people would eat at home. They're in an unfamiliar, stressful environment. They're sick. They don't feel well. There's so many barriers to eating well in hospital. And when we look at these are patients who already have existing malnutrition, it's definitely something we need to address. So again, when we look at, or when we're talking about how people are actually eating in hospital, we know that at least half of people aren't eating full meals, not surprising. And what's really interesting about, and this number applies to both hospitalized and non-hospitalized patients, but over 40% of people are not meeting their protein requirements, and the protein that they're taking in is not always the highest quality. So it's definitely a big issue in our role. So the impact of malnutrition, and this is where it really becomes quite important to address, is with malnutrition, of course, there's lean body mass loss, and that's associated with hospitalization, not eating enough, and then bed rest, not getting up and moving. There's a lot of negative impacts from that. So things like delayed wound healing, impaired immunity, and increased infection rates, lower quality of life, because when you are losing a lot of your muscle mass, you become much weaker. It becomes much more difficult to ambulate yourself and be independent, impaired function. And then the big ones, of course, are increased length of stay. So you're staying in hospital longer, it's harder to go home, increased readmission rates, and increased mortality and morbidity. So malnutrition and not eating enough, it's full system. It impacts all areas of our health. So that's why a huge portion of our role is to identify those patients who are malnourished and then to put some sort of treatment plan in place so that we can try and address it as best as we can. So what are we actually doing to combat malnutrition at STEGH? Lots of things, but a couple of years ago, all of the local hospitals actually launched a malnutrition screening tool. So every patient who comes into hospital gets screened for malnutrition as part of their initial nursing assessment. So they get asked two questions. Have you lost weight in the last 6 months without trying to? And have you been eating less than usual for more than a week? So if they say yes to both those questions, then it triggers an automatic dietitian referral. We get the referral and complete an assessment and determine, is the patient actually malnourished, or are they at risk of malnutrition? And then what interventions can we put in place? So, my approach to malnutrition is very different than my approach to other nutrition patients, because it really is not about, eating healthy. It really becomes about getting calories in, and most importantly, getting protein in. So if there is absolutely anything that feels a little bit appealing to these patients, I'm going to try and accommodate that as best as I can. Oh, sorry. So that could be things like a lot of people are turned off by strong smells, or when you're sick, a lot of people, they just want cold or sweet things. So do you want to eat ice cream all day? That's fine. You can eat ice cream all day. Would a protein shake be a little bit appealing? Some people just want to go back to basics. They want soup and a grilled cheese. So that's really what we're trying to do, is just figure out, is there any way that we can get calories into these people? And I think a lot of times the family's going, oh, but that's not healthy. They're eating ice cream all day. That really isn't the issue right now. We just need to get some form of nutrition in to help their body fight and recover. I always tell people, because I think with malnutrition, for most of us, our big issue is overeating. So it's really hard to put yourself in the mindset of, well, you're watching your family member waste away, just eat. It's not that hard. But I always try and tell people, think of the last time you had the stomach flu, how hard it was to eat when you're so nauseated, or even thinking about food just turns you off. I know I just had 2 pretty brutal pregnancies, and I was very particular about what I ate. And if someone sent me a hospital meal that wasn't to my preference, that I wouldn't have eaten it. It's just a simple fact. So it's kind of resetting our mindset that, okay, it's not just as simple as just eat when you're sick or when you're not feeling well. Okay, so the next area of my job, and this is a big one. This is probably 60% of our jobs. So a big percentage, and it's definitely our most specialized skills. It's actually nutrition support. So this is nutrition that's provided not by mouth, not by kind of traditional means. It's more invasive nutrition interventions, either through enteral, which is tube feeding, or parenteral nutrition, which is intravenous nutrition. So I'm just going to give kind of a high-level introduction to both, because I'm not going to get too clinical, but it is such a big part of our job. And I like explaining to people that, yeah, it's not just telling people what to eat. There's some really clinical, more medical side of nutrition as well. So enteral nutrition, like I said, tube feeding, most people are more familiar with. It's basically giving nutrition in the form of a pre-made formula through a tube. So either the common types of tubes are either going through our nose, nasogastric, so nose into stomach, or you might have a G tube that goes directly into your stomach, or something called a GJ tube that goes into your stomach and then ends in the small intestine as part of the jejunum, which is where actually a lot of our nutrition absorption occurs. So I think a lot of people think that all of our digestion happens in the stomach. Our stomach releases stomach acid, which helps break down our food, but very little absorption actually happens in the stomach. Most of it is further down in the small intestine. So by bypassing the stomach, if you're dealing with a lot of nausea or vomiting or diarrhea, or you've got an obstruction, bypassing the stomach can actually be quite helpful and really help people tolerate their tube feeding better. So when you look at tube feeding, Ashley and I's role when we get a referral, or oftentimes when we're pushing for that tube to be inserted, we are doing a full assessment on a patient. So to determine someone's nutrition requirements, it's not just looking at their height and their weight history, but we really have to look at their medical conditions, because there's a lot of different medical situations that impact their nutrition requirements. So if you've just had surgery or you're critically ill in the ICU, you have significantly increased protein requirements. So it's our job to make an appropriate estimation of those nutrition requirements. And then from there, once we kind of figure out what they need, we're looking at our formulas. So at STEGH, we carry about 8 different formulas. They're all specialized for different reasons. So we have a renal formula for those with kidney failure, or a diabetic formula for those with diabetes. We have formulas that are already partially digested for you. So if you're having a lot of trouble tolerating your nutrition, we might go to those. So again, it's not just as simple as putting in the tube and then throwing some formula down. We really do a lot of calculations. We're looking really closely at the blood work. We're choosing a formula that's appropriate for that patient. And then after we start the tube feed, We're really working closely with the patient and the nurse to make sure they're tolerating, there's no issues, the blood work remains stable or improves. So it is kind of a more clinical aspect of our job for sure. The other thing I wanted to touch on is that tube feeding can be supplemental. I think that a big misconception is that either you're eating by mouth or you're tube fed. And in a lot of cases, especially for those malnourished patients that we talked about, they are just simply not able to eat what they need to by mouth. So, and when you think of it, when someone is chronically malnourished, their body goes into starvation mode. They no longer feel hunger cues. And when you don't feel hunger, it becomes very, very challenging to eat enough. So by inserting a tube and giving them some supplemental nutrition, we actually prove by properly nourishing them, we actually start sparking some appetite. And in a lot of cases, they're able to eat more and actually wean off the tube feeding. So I think a lot of people's fear is that if I resort on tube feeding when I'm sick, I'll be on it for the rest of my life, or it'll be so hard to get off. But that's really not the case. Our goal is always, when possible, to get patients back to eating a regular diet by mouth. Okay, so I'm going to touch on our parenteral nutrition, our TPN. So again, basically all you need to know is that this is IV nutrition. So it's prepared in the pharmacy. It's a combination of dextrose for carbohydrates. We use individual amino acids, so completely broken down protein, and then lipids for fat. So it does mimic, our macronutrients that we need. And then it's also got vitamins, minerals, electrolytes, all the things that we need basically to fully sustain someone. So when we're using intravenous nutrition, it's because for whatever reason, someone's gut isn't functioning. So maybe they've just had a major GI surgery, maybe they've got a cancer that's impacting the GI tract. They maybe have an obstruction or really impaired swallowing, and we can't get that tube feed into them. So it's really, we use this when there's a non-functioning GI tract. And it's complete nutrition right into your intravenous, or right into your venous system through a vein. So same as like an IV fluid, only this just also contains your amino acids, your lipids, and all of your nutrition in it. So this is probably the most complex, most clinical area of our job. So lots of math, lots of calculations. We have to monitor the blood work really closely, on blood sugars as well, because TPN can really spike those. So just kind of touching on the fact that, it's not just telling people what to eat. It's there's a lot of different things we do in our role. I just wanted to put in one quick slide about refeeding syndrome, because again, a little more clinical, but basically when we're looking at these chronically malnourished patients, when we re-nourish them, when we give them nutrition back, a side effect of that is that there can be a massive electrolyte shift that happens, and it can be quite dangerous. So especially with our nutrition support patients, but all of our patients that we identify as severely malnourished, when they come into hospital and we start re-nourishing them, we have to monitor that blood work really, really closely, because it can be quite a significant shift and be quite dangerous to the patient. And a lot of times, especially, it can be really hard to catch with patients who are eating an oral diet, who for whatever reason weren't eating prior to coming into the hospital, but then eat really well when they get in. And all of a sudden, everyone's kind of putting their head against the wall, like, what's going on with this person's blood work? And we'll say, oh my gosh, they're refeeding. So that is another big part of our role. Okay, so the last big area of our job that I'm going to talk about is wound care. So a lot of people don't think, we know wound care is a massive issue in hospital. Of course, there's our surgical wounds, but there's also in healthcare pressure injuries. And for patients who are in bed for a long period of time or have limited mobility and poor nutrition status, pressure injuries can be a major concern. And once patients develop them, they can be really, really challenging to heal. It's a major cost in healthcare and just a huge impact on patient quality of life. But I think what's missed a lot of times is the really big role of nutrition in our pressure injury management. So our key nutrients in wound healing are energy, so calories, protein, fluid, and vitamins and minerals. So when you have a wound, especially when it's fairly significant, your energy requirements can double. In some cases, they can be, 50% higher, it can be a substantial difference. So when we look at our hospitalized patients already being very challenging to feed, and then all of a sudden they have really, really high nutrition requirements because they have a wound, that does a lot of time require a dietitian to help navigate that and really be putting in some high energy, high protein interventions. Same goes for fluid. Hydration is very important. And then vitamins and minerals. There are a handful of minerals, especially, that are very important. We know they have a big role in wound healing. So vitamin C and zinc being two of the big ones, especially if that wound is draining, we lose a lot of zinc in that drainage. So we might look at supplementation in those cases. So there are modifiable nutrition hydration risk factors. So these are things that when we're getting a referral for a patient that has a wound that we're looking at, and we want to address all of these things to really maximize their potential to heal that wound. So if they've lost weight, that's gonna worsen their ability to heal a wound. If of course they're malnourished, if they're dehydrated, so of course the whole team's working on rehydrating that patient. Uncontrolled blood sugars and diabetes are a major barrier to wound healing, hypothyroidism, iron deficiency, and then any of our vitamin and mineral deficiencies. So again, it goes beyond just saying, okay, someone's got a wound, let's throw an Ensure on their cart. We're really actually doing a complete assessment, looking at their blood work, collecting a history, seeing how they were eating beforehand, and trying to address as many of these modifiable factors as we can to help them promote the ability to heal that wound. So again, what we're primarily doing is addressing increased protein and energy requirements. So in hospital, that's maximizing whatever they can. So it's maximizing their oral diet, making sure they like the food that's coming on their trays, maybe doubling up on portions. We may be looking at oral nutrition supplements like Booster Ensure, protein shakes. We have a supplement program. What's not in the next slide, that's from a different presentation. We have a supplement program at STEGH that's really effective, where we give just a small quantity of supplement 4 times throughout a day with medications. So we actually, it's accountable. We can actually see on their medication administration record if that supplement's being consumed, which is a really good tool for us. And then we, of course, have high protein snacks and other interventions we can put in place. And for patients who have advanced wounds, we do have a wound cocktail that we order with that zinc, the vitamin C, and a multivitamin as well. Okay, I'm going to talk a little bit about Nutrition Month. So I kind of touched on the beginning that every March is Nutrition Month in Canada. So Dietitians of Canada releases a different theme each year that's relevant to the particular year. So this year's theme is Ingredients for a Healthier Tomorrow. And when I first saw it, I didn't really know what it meant. But I actually really like the theme for this year, and it focuses on the fact that making sustainable changes across the food system is very complex, and there's a lot that goes into it, and just kind of opening up our eyes to all the different roles that dietitians have within the food system, and then the fact that there's a whole bunch of ingredients that we really need to address to spark change. So things like food security, food literacy, food sovereignty, making sustainable food choices, as well as our nutrition care and prevention. So I think that's so often the piece we think of is, what is our actual nutrition care? How are we educating people? So obviously in hospitals and long-term care centers, also more and more doctors are attached to family health teams where they have dietitians on staff to help more with that preventative nutrition piece. But there's so much kind of behind the scenes that I think we don't think about. It's actually the 40th Nutrition Month, which is kind of interesting. And last week, March 17th, was our annual Dietitians Day. So kind of nice to recognize dietitians. So I just wanted to take a minute to just pull out a couple key points from Nutrition Month. So like I said, I actually really like this theme because it focuses on the fact that our food choices are so complex. It's not just about nutrition. I think so often nutrition is so simplified. This is what we're supposed to be eating, so just do it. But there's, like I said, there's so many barriers and challenges, and food choices are not just, we have to think about sustainability, cultural preferences, sorry about that, education, availability, resources, and support. But we also have to think about, sorry, I don't know how to mute that. We also have to think about the psychological impact of food, and food is very emotional. It's not just as simple as, you know, telling people what to eat. And we are making countless food choices each and every single day. So it's not like you have to choose what you're eating once a day and make a good choice. You're choosing over and over and over, and we have constant exposure to convenience foods, and food is not just for nourishment, it's for celebration, it's emotional, it's social. So just, I think that this seemed as a good idea of kind of opening our eyes to the fact that food is more than just nutrition. And what I really want the takeaway to be from this is that dietitians are involved in so many aspects of nutrition that we don't see or think of regularly. So like I said earlier, it's not just about telling people what to eat. That really doesn't work. But the way I look at it is nutrition is the foundation of our health. We know that when our nutrition is good and we're properly nourished, we feel so much better. Our quality of life is so much improved. We have more energy, our digestion is better. We are less prone to disease and autoimmune conditions. And we're kind of failing in that area right now. We know that there's an obesity epidemic. We know that autoimmune disease and allergies are on the rise. So I think that, we need to focus on more than just the nutrition, but actually addressing some of the barriers behind people's food choices. And I mean, anyone who's grocery shopped in the last few months has seen that their bill has doubled, and that's a huge barrier. And eating healthy is oftentimes looked at as more expensive, and then with the price things so much higher. So so dietitians are involved in things like creating food policies for things that you wouldn't think of, like what's appropriate advertising to kids for food, advocating for more public health resources. They're not just, and then of course the other part of our job is actually providing that nutrition care and that education, because of course that is an important piece. So that's kind of my takeaway with that. So we're a little bit ahead of schedule, but I wanted to give lots of time for questions. Like I said, I'm a total nutrition nerd, so I am happy to answer questions not only about the presentation and things that I touched on, but if you have any general nutrition questions, you know, if you're curious, other people are probably curious as well. So I'm happy to answer any questions. And I did just throw up a couple of kind of areas of nutrition that are popular in the media right now. So if anyone's stumped, but these list of questions seems interesting or you're curious, you're welcome to ask away.
Thank you so much for that, Kelsey. That was so informative and so engaging. We do have one question in the chat box from Diane, and it is, what vitamins and minerals do water pills decrease, and what are the best foods to eat to increase?
So oftentimes water pills, like diuretics, are potassium wasting. So we excrete extra potassium in our urine with them. So we do see a lot of low potassium levels when people are on diuretics, especially in hospital when we're diuresing people and getting rid of a lot of fluid. It's not as common in community. So you can take a potassium supplement or you can get it from the diet. Potassium has a very high recommended intake. And I find that most people are not getting enough potassium as it is. Potassium primarily comes from our fruits and veggies. So foods that are high in potassium are potatoes, tomatoes, oranges, orange juice, milk is high in potassium. Lots of our green veggies are high in potassium. But like I said, it is quite a high target to hit at the best of times that most people aren't hitting. And then if you're losing extra potassium from your water pill, I just recommend that if you're on any medication that's impacting your nutrition levels or your vitamin levels, you should be getting them tested at least annually, if not biannually. I think that piece is missed a lot. And, you know, a lot of doctors will recommend that, but then there is also the fact that doctors are so busy, so you do have to advocate for your own health a little bit. But if you ask, you're generally always able to get your levels tested. So sorry, I missed, I think, the second part of that question, or did I hit it all?
I think you hit it all, and it was just the best foods to increase. So yeah, I think you hit everything.
Okay, perfect.
The next question we have in our chat box is, Lisa is curious if you treat post-brain injury patients, either in your private practice or inpatient, and the primary focus for registered dietitians while working with post-brain injury.
Yeah, so I actually have more experience with this working on the stroke unit. Stroke unit is one of my units that I cover, and we do see traumatic brain injuries with stroke. So yeah, I think that the biggest challenges that I've seen are taste change, dysphagia sometimes. No, it doesn't hugely increase nutrition requirements, so we're not dealing so much as that. But a lot of times it's getting the proper nourishment in because they may be on a texture modified diet. And we know that if patients are on pureed foods or thickened fluids, those are not always the most appealing to people. So it becomes really challenging to, again, even maintain baseline nutrition levels on those types of diets. And then what was the other thing that I said? Was traumatic brain injury, taste preference and taste change can be a big one. So having bitter or metallic tastes, not liking things that they've liked previously. So navigating that can be quite challenging as well.
Awesome. Next question. So what are the best vitamins to take, and do you recommend milk thistle?
Okay, milk thistle is for liver support. So milk thistle, it does actually have, for an herbal supplement, it's got decent evidence behind it. I don't recommend it for the general population. I think you have to look at why specifically. Like for supplementation, my approach is always that supplements are to supplement your diet. So if you have specific liver issues, milk thistle can be effective. Again, I would always check with your doctor or your pharmacist just to make sure it's not interfering with any of your medications. Sometimes if people are on a lot of medications, which of course does place a strain on the liver, then I might recommend milk thistle. Other things like alcoholism, milk thistle may or may not be slightly beneficial. Again, it's just more for liver support. So anything that's particularly straining on the liver, milk thistle could have a role. In terms of vitamin, I think the question was asked, what are my thoughts on like a general multivitamin? Is that the question?
Yes, that's another question.
So I prefer to actually pick and choose, like do a really in-depth review of someone's diet and actually pinpoint maybe a couple areas that they might be missing. So if someone is vegan or vegetarian, they might be lower in vitamin B12 or zinc or iron. So I prefer to look at it that way and actually address those specific issues. A lot of our general multivitamins that are like available at the grocery store, for instance, they don't always have the most high quality or most bioavailable form of vitamins. Some of the vitamins can actually counteract with each other a little bit, like having calcium and iron in the same multivitamin. So my approach personally is I do prefer to just supplement what you actually need versus taking a general multivitamin. The times where a general multivitamin might be more beneficial or that I recommend them more are, of course, during pregnancy. I would recommend a prenatal. People who have impaired nutrition absorption. So if you have a GI disorder like IBS or inflammatory bowel disease, where you're having a lot of diarrhea, you have really quick GI transit time, you don't absorb your nutrition that well, I think a multivitamin can be a really good kind of backup there. Or if your diet is quite poor and for whatever reasons you're just not able to address that, then it's not a bad assurance in that case. But I definitely don't think it's something that the general public needs. A well-balanced diet pretty much does cover all of our bases.
Amazing. Next question. So for someone who is looking to add more plant-based foods into their diet, what are some good swaps that they can start with?
Okay, so the biggest thing with more plant-based diets, I've been vegetarian for years, I was vegan for years, so it's definitely a passion point of mine. But I think the thing that we know about plant-based diets is even having 1 or 2 meatless days a week is so beneficial for health and for environment. Our current level of meat intake is really not sustainable from an environmental perspective. So I do think it's something that all of us should be looking at. It's also a great opportunity to get more fiber or more diversity of plants into your diet by pulling the meat out a few times a week. But what I find when people do that is they just take their regular meal and they just pull out the meat, and then they're starving and they think, well, I can't have a plant-based a day. So if you would have pasta with chicken and veggies and you just pull out the chicken, of course you're going to be hungry and you're not going to get the protein that you need. So I think for simple swaps, so if you look at something like breakfast, you could sub a coconut yogurt instead of like a Greek yogurt or a milk-based yogurt. You could use a vegan protein powder in a smoothie. Lots of nuts and seed butters, they're all vegan or plant-based, and they're a good source of protein and healthy fats. So I think, yeah, it's the protein and healthy fat that you need to think of in order to keep yourself sustained. Tofu is one that a lot of people are intimidated by. They don't know how to cook it. They maybe have had a bad experience with it. Tofu on itself is quite bland. It needs to be cooked properly. I know I've been vegetarian for almost a decade, and I really am particular with my tofu. I like it, but I like it the way I prepare it. So I think you have to play around with it a little bit and learn how to cook it. What else would be good? Oh, an easy swap is swapping in a bean or a lentil pasta for your regular pasta. So something like a chickpea pasta has about 20 grams of protein a serving. So if you do want to have a pasta meal without meat, that's such an easy swap. It's really high in fiber. It tastes just kind of like a whole wheat pasta, and you're going to get all the protein that you need just from the pasta. You do not need a meat or an animal-based protein in that meal. I think another easy one is like if you had a curry, instead of putting shrimp or chicken in it, would be substituting chickpeas. So it's just getting a little bit creative and maybe thinking outside the box. But I think a lot of times what doesn't work is trying to eat the exact same way that you normally would and just either pull out that protein or trying to swap it with someone, because it's not always the best combination. So I always find that taking some inspiration from international foods is a great idea. So if you look at like Indian diets or like Japanese diets like sushi, or what else, even Italian, it's so easy to eat plant-based with when you're eating from those types of restaurants, because so much of their diet is more plant-based. So I really like going to something like a curry, because it often is made with a legume anyways. So you don't actually have to just think of, well, how do I rearrange my meat and potatoes meal? Maybe get a little bit more creative.
Amazing. That's awesome. So next question, how do we keep our immune system healthy during COVID? And would you touch on healthy gut diets?
Yeah, for sure. Two of my favorite topics. So obviously when COVID first came out, there was so much talk in the media about how to eat to support immunity. And there is no immunity diet. There is no such thing as an immunity diet, but there is roundabout ways that we can support our immunity. So the only actual vitamin that's ever been shown to support immunity is vitamin C. It has a slight efficacy in terms of decreasing things like colds. Vitamin D actually was shown as quite effective with COVID patients in terms of not the risk of getting it, but less severe case of COVID. So vitamin D was shown as impactful with COVID, but 70% of our immunity is actually housed in our gut. So to me, support it, and this kind of plays into each other, supporting our gut health, having a really strong gut health, and I'll get into what that means, that in a roundabout way really does support our immunity, because so much of our immune system is housed in our gut. So that was always my approach to people. So when we talk about gut health, I think, like, what does gut health mean? My private practice is all about gut health, and I think people automatically think it means digestive conditions. So if they don't have something like IBS or inflammatory bowel disease, that they have fine gut health. But what gut health actually means when you look at it from a scientific perspective is when we're talking about our gut microbiome, so people may have heard of that. It's the system of bacteria, yeast, fungi, viruses that are housed within our large intestine. Our gut microbiome, or microbiota, is actually responsible for our gut health. And to have a healthy gut microbiome means that you have a diverse and abundant microbiome. So you have lots and lots of types of bacteria, and you have lots and lots of them, because when we're learning more and more of this about this all the time, they're in the process of actually mapping the microbiome and nailing down what each of those bacteria does. But it does work as an ecosystem. They all interact with each other. And things like viruses and bad bacteria actually can be present in a healthy gut and not be not be harmful or not be impactful because your gut health is strong overall. So it is that balance. So to support gut health or a gut healthy diet, it's all about fiber. Fiber is actually not digested through our stomach, through our small intestine. It reaches the large intestine virtually untouched, and it's then food for our gut bacteria that's housed in our large intestine. So the only thing that's going to feed your gut bacteria is fiber. But what's really interesting is our gut bacteria, they're kind of like you and I. They have taste preferences. So they feed off different types of fiber. So if you eat the same 4 vegetables every single week, if you go to peppers, broccoli, onions, and Brussels sprouts every single week, as a lot of us are prone to doing, we're feeding the same gut bacteria over and over and over, which is great, but we're completely neglecting the rest of our bacteria. So to get that diversity, we need diversity in our diet. So it can be as simple as, if you always get a can of chickpeas, get a can of mixed beans. If you always get red bell peppers, try yellow, green, orange. They actually have slightly different types of fiber, which feeds slightly different bacteria. So there was a study done a couple of years ago that showed getting at least 30 different plant foods every single week was the best thing that we could do to support our gut health. So when you look at our plant-based food categories, it's whole grains, fruits and vegetables, beans and legumes, nuts and seeds, and herbs. So you want to actually eat from all those food groups. So the worst thing you can do for your gut health is be on a restrictive diet. So if you're a low carb eater and you completely eliminate whole grains and your beans and legumes and a lot of your starchy veg and your fruit, you are left with such a limited quantity of what plant foods that you actually can eat. So you're really not supporting your gut health. And we're seeing some new evidence that things like keto diets are actually terrible for our gut health, because they are basically an anti-gut health diet. They're very restrictive, and a gut health diet is all about abundance of plant foods. That was a long explanation, but I can talk all day.
That was amazing. Thank you so much, Kelsey. Next question. So what is the general cost of a personal consultation / workup to get the process started?
Yeah, absolutely. Oh gosh, I was a little bit awkward talking about money, but yeah. So I did actually last week increase my prices too. I did some research and found out that I was kind of not meeting industry standards, but the reason I increased them is, for me, an initial consultation is $160. And that may seem a little bit steep, but it's an hour-long consultation where I go through and collect a really intensive diet and lifestyle history, and then start mapping out a plan with you. But the reason I increased it is because I send out a completely customized care plan after that. That's usually like 4 to 5 pages of personalized recommendations. So I take a lot of time behind the scenes to actually think about a plan, and I get very specific. If I'm recommending meals, I'm talking like brands, where to find them in the grocery store, supplements, and not just general supplements. Supplements are not all created equal. I like supplements that are third party tested, that we know what they're actually in and that they're high quality. So I'm giving you like links for specific brands. So anyways, me just justifying my cost. But yeah, I would say almost all dietitian consultations that I've seen are about $150 for an initial, but it's an investment in your health. A lot of insurance plans will cover dietitian or nutrition consultations. But yeah, the way I look at it is our health is invaluable. Nutrition is the foundation of our health, and a good dietitian will not just tell you what to eat. They will work on you with your barriers and where you're struggling.
Absolutely. That's wonderful. What are the dangers of too much sugar and or salt in someone's diet?
So it really depends. If we're talking about the general healthy person, it's very different than talking about someone with compromised health. So obviously, if you have diabetes and you're eating a lot of sugar, you're going to have uncontrolled blood sugars. That's not going to be great. If you have any sort of cardiac condition like high blood pressure, eating a lot of salt is not going to be great. It's going to increase that blood pressure, make it more difficult to maintain. In a general young healthy person, eating too much salt, here and there is going to have no impact. Our kidneys are going to filter and get rid of that salt, and it's not going to have long lasting impacts. I think that the way I look at it with salt is that what foods are really high in salt? Fast food, processed foods, those types of foods are also really high in calorie, really high in poor quality fats. They're really high in sugar. They are maybe potentially have inflammatory ingredients in them. They are not supportive of our overall health. We want whole foods, lots of plant foods, diversity, like I was talking about. So the way I look at salt is that if you have no health conditions, it's maybe not imminently dangerous. Although we never know if we may be, our blood pressure is creeping up, getting a little bit high. But if everything's functioning well, it's not imminently dangerous. It's more about what quality of foods are you eating that are so high in salt. Processed meats we know are significantly increase your likelihood of certain types of cancers. So it's not just enough to look at the one nutrient. With sugar, the biggest concern is weight gain. Typically, sugar, empty calories very quickly, or simple sugars, very quickly convert and easily converted into fat in the body if it's not used. If we have excess calories, sugar is the easiest thing to convert, then fat, then protein. So I think it's a big misconception that we can't gain weight from eating too much protein. We absolutely can. It's just a little bit more of a complex process for the body, whereas things like simple sugars, they're so readily available. We uptake them really quickly. So we have this burst of available energy. But if we're sedentary, like most of us are, or you eat a donut and then you're sitting at your desk and you've had excess calories, then it is easy for that body to store that sugar. So that's the biggest concern, is just maintaining like a healthy weight in the long term.
Amazing. And the last question I have in the chat box is, we don't hear about how to improve our diet pre-surgery. Is that a void/gap in our healthcare process?
For sure. I know that pre-COVID, and I don't know where the program stands right now, there was a prehab program for hip and knee replacement patients, and nutrition was a part of that because, as I've touched on, nutrition requirements post-surgery are significantly elevated. So whenever I talk to someone, in my personal life, if they're going for surgery, I'm really emphasizing how important it is to take care of your nutrition before surgery, because you don't want to go into surgery behind. And then post-surgery, just how important getting enough, eating well, and especially that protein piece is to recover and for your body to heal. Is it a gap? Absolutely. I think COVID has really opened our eyes to the challenges in healthcare, and we're spread pretty thin. And I think that, there's so many areas where nutrition could be more preventative and does get overlooked a little bit. And that's why dietitians, that's why I'm getting out there using our voice.
Absolutely. That is amazing. I think that's it for the chat box right now. If anyone has anything else to type in there, if you'd like to unmute yourself while we have Kelsey on the line, please feel free to do so. Those were some awesome questions and some great discussion. So thank you for participating. Okay, with that being said, I think that we will end our Q&A. So Kelsey, thank you so much for coming here today and for sharing your expertise and your knowledge. We're very lucky to have you support patients at STEGH, and you play a huge part in their recovery and the entire process. So thanks so much for being here today. It was a wonderful way to celebrate Nutrition Month. So if any viewers have any comments, questions, or general feedback, please feel free to email us at info@steghfoundation.ca, and we will most definitely follow up with you with the link to the recording. Please feel free to pass it along, share it with your family members and friends. STEGH Talks is a series of presentations that the foundation, in partnership with the hospital, will be hosting regularly. In celebration of Laboratory Month in April, we will be presenting a special STEGH Talks session on STEGH's lab. So thanks so much to all of you for being here today. Thanks so much again to Kelsey for presenting, and we all hope you have a wonderful day.
Great. Thanks for having me.